millions of people worldwide are infected. Innovation is at the forefront of moving beyond COVID. Organizations have tremendous responsibilities, but they have even more questions about how COVID, how a vaccine, and how health policies will affect us both today and certainly in the future. Today's participants, our great panel, include Dr. Sylvia Trent Adams, the former Principal Deputy Assistant Secretary for Health. She is retired, and she is presently the Senior Vice President and Chief Strategy Officer at the University of North Texas Health Sciences Center. In addition, I have Lieutenant General Nadia West, the 44th Army Surgeon General, and also a good friend, and Dr. Eric Moore, Director of the Biological Center, U.S. Army Research Development, Department of Defense. So, first question is to Dr. Trent Adams. You are a senior advisor on health and one of the nation's top healthcare executives. What are your thoughts regarding our present COVID-19 pandemic?
Thank you so much for that question, Admiral Robinson. I think right now, as you indicated, we are in a state of crisis. Without a comprehensive national plan for response, we are in jeopardy of losing even more lives. I think we've launched as well of an attack at the local and state level. We need to be more coordinated and adhere to the scientific and evidence-based practices that have been presented. Our nation is suffering from many deaths and even more infections, as you have indicated. We need to understand that we will not move forward in being able to mitigate the risk of future infections if we do not begin now, looking forward, using every precaution we possibly can to stem the tide of future infections, such as wearing masks, social distancing, washing our hands, and making sure that every level of policy is implemented at every single level of government and within the communities. Community spread has been a major factor as it relates to more deaths and infections in underserved communities and those living with underlying health conditions. As we've looked at the national scope of many of these issues and many of them underserved communities, we know that there are now lingering deaths and even more that have been unreported. We must be vigilant in our ability to share data, collect data in a systematic way, and making sure that our labs have the capacity, that our healthcare providers have PPE, and that we're doing everything we possibly can from a public health standpoint to message consistently and message with meaning so that everyone can understand it at their level of engagement. I would go on to say that we have done a great job of making sure that the policy community is coming together. We need to make sure that the policies that we develop are in keeping with the understanding that at every level of the organizations where we work, live, and play, need to have messaging and have the ability to share with those individuals that they have influence over to get the message to those at the lowest level of our communities. Many communities have not received messaging in a language or in a way that they can understand it. And we have to own that responsibility. We have the greatest minds working on the policies at the federal level. We have policy innovation that's happening to make sure that those individuals who have underlying conditions understand the disease burden in their communities. We want to make sure that we use every tool we possibly can to empower providers to meet their patients where they are and to serve those that are coming into their facilities, have safe and effective treatments that are available to them.
Thank you, Dr. Trent Adams. I'm slow this morning because sometimes it takes me a while to drag that arrow over to the unmute bar. Next on our panel is Nadia West. Nadia, what do you have to say about? Excuse me, General West. What do you have to say about the pandemic and your thoughts of it as you've left the Surgeon General's chair, but now you're in private sector and in healthcare, what are your thoughts regarding the COVID-19 pandemic?
Well, thanks, Admiral Robinson. And of course, you can call me Nadia. Like you said, we're friends and go way back. So really appreciate the opportunity. And I also want to just say what an honor it is to participate in this conference, and specifically in this panel that's addressing what I believe is an extremely important topic of preparing to innovate in the whole global health security context. And as we've seen, the medical community is no stranger to innovation. From the Hungarian physician, Dr. Semmelweis, who in the 1840s proved that simple hand washing saved lives of women who were dying of childbed fever, all the way to Alice Ball, a Black chemist who in 1915 actually became the first woman and African American to graduate with an MS degree in chemistry from the College of Hawaii. And at the age of 23, discovered a life-saving treatment for leprosy, something as a dermatologist that's very important for me. So those were monumental discoveries, but it took years, if not decades, for those innovations to become widely adopted. And in the current environment where globalization has facilitated the rapid transport of infectious agents anywhere in the world, we really don't have decades or even years to disseminate evidence-based best practices and remedies. And that's why, to your question, Adam, that's why I want to briefly introduce three topics that I think are really important to prepare ourselves to innovate. First is how healthcare professionals lead in this environment. So we all know, and that's in the public sector and in the military, private sector, wherever you are, we know that leadership is the activity of influencing others by providing that purpose, direction, and motivation to accomplish the mission. And it captures the essence of what we're supposed to do as leaders and implies what we should know and what we must be. But in this environment, I think, again, basic tenets apply in any environment, but in this current environment, what a leader must be is much more important. And that's, of course, being a leader of character that your people can trust is more important than ever, where there's isolation, dispersion, the alteration of information distribution methods characterize the day. The attributes of agility and adaptability are key, as well as what we're hearing about now with humility and empathy. Being comfortable that you don't have all the information and all the answers is critical. Understanding the strengths of the members of your team and what skills they can contribute and truly including them is critical. So we talk about diversity and inclusion almost as being a luxury, but in these times, it's absolutely vital. So we aren't dismissive of the very person or team that might have the solution we're looking for. And I see that in industry. Of course, we saw that in the military. It's really important to do that. And companies who do that are actually a lot more successful. So the second topic is how quickly we embrace that healthcare has moved into a culture of accelerated innovation. That historical vignette I mentioned about hand washing, though proven to save lives, many clinicians refused to adopt it because they could not believe a germ was the problem rather than some evil humor that was in the air. And by the way, who was this Dr. Semmelweis anyway to tell them what to do, even when they saw for themselves that it made a difference? So thousands around the world continued to die for decades until hand washing became routinely adopted. And we have that same problem today on a different scale. Evidence-based therapeutics and practices sometimes take years to widely implement. We have to move safely, move faster. And the third point is the importance of fostering sustained, multidisciplinary, multi-agency approach to innovation in the healthcare space. We're really good at coming together in crisis, such as during the response to Ebola in 2014, where the interagency, academic institutions, private partners all work together on a solution. But the time-limited task force method that we use and how to approach problems that rapidly assemble a group to address the need and then disassemble when it's over needs to morph into sustained partnerships. And this will truly require embracing a culture of inclusiveness that transcends anything we're used to today. I mean, just look at how difficult it is to assemble a diverse group of people that are truly included. Now start laying.
Sure, oh, there's Matt and Deborah Tedford. Okay, we're gonna take the picture. We can redo later if we need to. On three. 1, 2, 3. All right, we got it. Thank you.
Events are like a rose without the smell. Well, so far, this has been a rose with the smell. Our trusted community has truly come together. It's certainly filling up my gas tank and giving me the energy and helping me deal with the isolation and all of those other issues that I know each and every one of you are going through. Somehow we're making this happen in the intensity